Here in Bloemfontein, workers from Engo on stage have downed the tools. They demanding that the facility should be disinfected. This after, of course, a resident here, as this is an elderly facility, have tested positive. Now they're saying that the management have not taken the precautionary measures. They want, of course, also to be quarantined while waiting for their results. I understand that workers have been tested from Monday, but they are saying that's not enough if they continue to come to work and the facility has not been disinfected. But I'm just going to talk to one of the workers here. Jacqueline, thank you so much for your time. Talk to us. What exactly do you want to see happening here?
I want to see this place being disinfected, because now we have been tested and they don't even want for us to go off to quarantine. They want us to come back to work while waiting for the results. And according to the protocol that we know of COVID-19 is that while you're waiting for the results, you must quarantine. So they want us to continue coming to work, and they even ask us to come to disinfect the place, we the workers. So we don't want to come back to the place that is still infected with the COVID, because we don't know how much the place is infected. The information that they're giving is that the resident was only in one corridor, but that is not what happened. The resident moved from one corridor to another, visiting another resident. So the disease might be anyway. So that's why we want the place to be disinfected, and the resident must also be tested because she was also in contact with the other. And the other thing now, they have called the relievers to come and work in our place. And these relievers haven't been tested or haven't been isolated. So what if these relievers from outside coming in here where the place has been on lockdown and we come back to work? It's a risk for everybody, and the manager has to make sure that she ensures that the place is safe for her workers, which is the thing that she failed to do. She didn't even follow the right protocol, because I don't understand how can she admit somebody not knowing the status of the resident in this area that we are here now. So we are in this situation because of that. It's not that we don't want to go to work, but we want to be safe here.
So basically you're saying you will down tools until your demands are met. You are saying that you are the one who are supposed to disinfect the area.
She said so. That's her word exactly. She said instead of us acting irresponsibly, we should go back inside and take the gloves and the sanitizer and start disinfecting the place.
Just one of the frustrated workers here saying that the management is saying they're supposed to be the ones who are disinfecting the place, and they are saying they are not feeling safe with the situation, and also saying the relievers that have come to relieve them since they have downed the tools, of course it's not enough, because also they have not been tested and they are coming to the area where an elderly person was tested positive. But I also just want to hear from the union here. Mr. Sebutsa, thank you so much for your time. Talk to us. What is the management saying about this matter?
Ma'am, our attempt to speak to the management drew a blank, because this is a very arrogant management. Initially, like the workers explained, they wanted to hide it. They wanted to play hush-hush. And you and I would know how serious it is to actually have a COVID-19 patient in an old age home. These are the most vulnerable patients. These are the patients who are likely to die. We have one patient who's positive. Within 5 days, the entire old age home would be dead. So our attempts to speak to the management are really not yielding results, because they want us to negotiate how best to deal with this. And there's no negotiation where lives of their own patients are involved, where lives of our members are involved. So we are saying the place must be closed. The place must be closed, be totally disinfected by the professionals, not the workers themselves. And we've got a list of demands, ma'am. The other thing that workers will tell you is that they have been using cloth masks. Imagine, this is the old age home, not even in a hospital where patients are not as vulnerable as these ones are over 80, over 90. And yet workers have been using their own cloth masks, not having gloves, not having surgical masks. So we are saying, as and when they open, then they must open properly, they must open with proper PPE, then they must make sure that, as you arrived here about 30 minutes ago, you have been seeing up and down. Each and everybody does in and out as they want. And you don't even see that in the hospitals. And yet here it's done. in the most vulnerable patients. So we are calling on the minister and we are calling on the MEC to close down this place. This guest house it's part of the group. They can relocate the patients to some other area, and then the other issues are obviously the ones that the member has already mentioned.
Mr. Sibota, has this incident, is it common here in the Free State, or is the first incident you are encountering here?
It is the first incident we are encountering in the Free State. We have never had such in an old age home. At least where we are organizing, we don't know of such. Hence, we expected the management to act swiftly, not to attempt to sweep the matter under the carpet, as they are seeking to do. There's no negotiation when it comes to workers' issues. It must be a clear closure of the place, disinfecting of it, as it happened with Netcare and others in Debe. So these ones are seeking to sweep it under the carpet. And we are saying, as we need to, we are not going to allow it.
Thank you so much, Mr. Sibusa is from the union. Of course, also sharing the frustrations to say that this place needs to be closed down and professionals should be coming to disinfect. They're saying it's not enough that workers are not being quarantined while waiting for their results, and also saying this is, of course, trickling with their lives, and also saying that the Department of Health should come here and, of course, shut down this place while they are busy making so sure that there's precautionary measures are. Otherwise, they're also saying that the residents, which are the elderly people in this area, should all be tested. They're saying testing should be compulsory here because this person who was found to be positive was not staying in one room but has been moving around the facility. Now they're saying that they won't stop with this demonstration until their demands are met, but we will talk to the management and just to understand their side, and also these allegations that they want workers to be the ones that are disinfecting the area. And also we see some members of the EFF came in support of this demonstration, saying that they will support them until their demands are met. We'll also talk to the Department of Health and just try to understand how have they been involved in this scenario, knowing that they always, of course, assist where possible in terms of testing. But for now, I can say it's back to you in studio.
There's something that I'm just watching behind you with regards to those that are protesting there. We know that this virus spreads through respiratory droplets, and you can hear full-throated songs coming out of the people standing behind you who are in a bit of a tight circle. Some are indeed wearing masks, if not all. But are there any concerns that if someone is indeed infected there and you are singing, if somebody doesn't have their masks on properly, that might spread? Is that a concern there?
There is a concern, of course, Blaine, as we heard also from the union, saying that they are even using cloth masks instead of surgical masks. That's one of the demands that they want, and saying that, of course, their lives is being threatened by the situation here. Not even a single day they were given a surgical mask to take care of elderly people. And also the concern is that they are taking care of elderly people, which we know they are vulnerable when it comes to this pandemic. And now they're saying precautionary measures should be in place. It's not that they do not want to work, but they want to work in a safe environment. That's what they are demanding, Blaine.
Safety is indeed key. Aphumelele, thank you very much indeed for your reporting, as well as Bloemfontein in the Eastern Cape earlier on. We appreciate you guys reporting.